infection prevention and control. Please wash your hands. Infection prevention.
Hello everyone. We thank God for today and we ask God to give us more blessings and more good life such that we can progress with our studies. We have to look at the perineal body today in obstetric anatomy. The perineal body is a pyramid of muscles and fibrous tissue situated between the lower end of the rectum and the vagina. We want to look at this part. If we have a vagina here and the rectum is connected to the anal orifice. We want to look at the area around there, the area that is made covering the vagina and the rectum, and it is called the perineal body. This area measures 4 centimeters, but remember during second stage of labor it can stretch up to more centimeters during the process of birth. The shape of this perineal body is triangular. You can be able to see the triangular shape here of the perineal body, and that perineal body is situated between the vagina and the rectum. When you talk about the structure of the perineal body, it is made up of 3 layers. We have the outer covering of the skin, we have the superficial pelvic floor muscles, and the deep pelvic floor muscles. But we need to know that the perineal body is supplied by pudendal arteries, and so the corresponding veins are the pudendal veins. We have the lymphatic drainage, or the lymph drains into the inguinal node, and for the innervation, we have the perineal branch of the pudendal nerves. So the pudendal nerves are the nerves that supply the perineal body, this part that is triangular in shape, this part here. We are saying that by structure it is made up of the skin, superficial pelvic floor muscles, and the pelvic floor muscles. When we look at the functions of the perineal body helps us in defecation. When you empty the bowl, it is the perineal muscles that you're using, perineal body, because it's made up of the muscles. Use the muscles to put the undigested food, which is the feces, to push. So it helps in childbirth, and as well, it is an area where the episiotomy is given, where a woman is cut to enlarge the birth canal during second stage of labor. And when we talk about the urogenital triangle, it is found, of course, in the perineal body, and it is divided into superficial and perineal spaces. And when you talk about the anal triangle, it includes the anal sphincter and the ischio and anal fossa. So we have this anal triangle and urogenital triangle. They are parts of the perineal body. Let's now look at the pelvic floor muscles, which are the structures of the perineal body. The pelvic floor muscles, actually it is muscular diaphragm feeding the cavity and lying at the base of the pelvis. The perineal body is made up of pelvic floor muscles. Pelvic floor muscles are those muscles that are found filling the cavity and lying at the base and the skin. Now, when you look at this pelvis, it is having muscles here. So it is that muscular diaphragm. We have the superficial ones, see this way, and this side here, we have the deep pelvic floor muscles, if you are able to see them. We want to look at the pelvic floor muscles and the ones that I'm talking about. The shape of the pelvic floor muscles, they are gutter-shaped, and this influences the rotation of the presenting part as it passes through the birth canal. Because they are gutter-shaped, the fetus is able to go through. The functions of the pelvic floor muscles, one of them is to support the pelvic organs from prolapsing. Now, when you look at my pelvis here, we have a uterus inside here. This is a model of the uterus. Are you able to see the model of the uterus? This is the uterus and the uterine tubes. We have the uterine tubes here. We have the ovary here. Now, these are organs. We also have the bladder, we have the rectum, this way. Now, these pelvic floor muscles prevent these organs from prolapsing. That means they ham up this area such that the pelvic floor muscles do not what? Prolapse, such that they don't come out. And those are functions of the pelvic floor muscles. The pelvic floor muscles keep pressure when one is coughing or when one is sneezing. Now, my nanas, I want us to get our ankles out and we start sneezing. Let us sneeze and try to feel what is in the diaphragm inside the pelvic cavity. And let us now try to cough a little bit. So when you cough and when you sneeze, you are using the pelvic floor muscles. The pelvic floor muscles keep the pressure when one is coughing and sneezing, and we have also said that it prevents pelvic organs from prolapsing. Pelvic floor muscles help us in bowel opening and passing of urine. Remember, when one is having a full bladder, they can even make noise as they are using the perineal muscles to make sure that the urine flows by making a sound when they are like urinating or when they are defecating. So those muscles help us that way. And so during second stage of labor, when the mother is to push her baby, they keep the necessary resistance such that the baby can be pushed out of the vulva. Then afterwards, they are able to get back to their pre-gravid state. So those are the pelvic floor muscles and their functions. When we talk about the growth structure, if you are able to see the pelvic floor muscles pierced by 3 orifices, we have the urethra around here, we have the vaginal orifice here, and we have the anal orifice, which is the rectum. So the pelvic floor muscles are pierced by 3 orifices, meaning that there are holes that pierce them and their orifices. They are meant to pass contents out, like urine, like the feces. Growth structure still consists of 3 layers. We have the peritoneum, the muscle fascia, and the deep and superficial pelvic floor muscles, and then the skin out here. We have the skin, we have the superficial pelvic floor muscles next. We have the deep pelvic floor muscles here. We have the muscle fascia, and then we have the peritoneum. That is from outside in. But if you measure them from inside out, we start from the peritoneum, then the fascia of the muscles, then the deep pelvic floor muscles, then the superficial pelvic floor muscles, and then lastly, the skin. What is important among those layers are the 2 types of muscles, that is the deep and superficial pelvic floor muscles. Right away now, let us look at the superficial pelvic floor muscles. The superficial pelvic floor muscles are 5. Now, when you look at the urethral orifice, around the urethral orifice, there are muscles that surround the urethral orifice. And those muscles are known as urethral sphincter muscles. So sphincter is a muscle. They are urethral sphincter, so they are surrounding the urethral orifice. Then we have the ischiocavernosus muscle, rises from the ischiotuberosities along the pubic bone to the clitoris. The muscle is known as ischiocavernosus. From the ischium, there is an ischium this way, the muscle runs from there, then it is inserted into the pubic bone. Then we have the bulbocavernosus, The bulbocavernosus is also known as bulbospongiosus. They are muscles that rise from the perineal body down this way and pass on each other, encircling and strengthening the vaginal orifice, and then they are inserted into the pubic bone. Now, these ones are the pubocavernosus. These other ones, we have said they are the ischiocavernosus. We have another muscle that runs transversely that is known as the transverse perineal. The transverse perineal are muscles that run from the ischiotuberosity to the center of the perineum here. They run up transversely here and they are inserted at the perineal area. They are called transverse perineal. We have lastly the external anal sphincter. This is a muscle that is surrounding the anal orifice, and this is the external anal sphincter. Those are the 5 muscles that make up the superficial muscles of the pelvic floor muscles. Once again, we have a urethral sphincter. The urethral sphincter is not seen here, but it is surrounding the urethra. Then we have the bulbocavernosus. This one runs and encircles the vagina and is inserted into the pubic bone. Then we have the ischiocavernosus that run from the ischio area to the pubic bone. And then we have the transverse perineal as muscles that run from the ischiotuberosities and they are inserted into the middle of the perineal body. And then lastly, we have the external anal sphincter. Those are the muscles. Let's go to the deep pelvic floor muscles.